must stop irritating your sciatic nerve if you want to find relief. So in this video, I'm going to show you 3 ways to stop irritating your sciatic nerve so you can feel better. Hello, my name is Dr. John Cebulski and I'm a practicing chiropractor. I have been for well over a decade now. Now, each of these 3 ways builds upon each other. In other words, number 3 requires number 2 and number 2 requires number 1. Number 1 is going to be flexion extension of the spine. We're going to try to decompress the posterior elements of the spine as the sciatic nerve exits the back of the spine. It then goes down into the hip, which will be number 2. So we're going to try to decompress and open up the hip. But do not try to open up the hip if you've not tried to open up the back. So decompress the spine, decompress the hip, and then third, there's going to be a rotational element, which will again require number 1 and number 2, but it's the most complicated one and it often gives the most relief. But if you cannot do number 1 and number 2, number 3 often will not work. So let's get into number 1, flexion of the spine. These are my favorite 2 ways to do it. The first exercise is a classic with an addition. You're going to be doing a cat-cow raise with the knees. So once you have completely arched your back and tilted your pelvis, really make sure to tilt the bottom of your pelvis, your pubic bone upwards, and then raise the knees. As you raise the knees, it should add a little extra tension to the core, which will cause compression in the front and decompression of the spine. The second exercise is door frame knee swings. Grab the door frame at about hip height. It'll be a little bit easier if you grab a little higher and harder if you grab lower. But the goal is to slowly allow your knees to go forwards over your toes and then back. You should feel a really nice stretch in the back. If you want to stagger your feet a little bit, put the left in front of the right or the right slightly in front of the left, you'll feel a little bit more of a stretch on one side of the back or the other. But the goal is to let those knees swing back and forth gently as you feel your low back decompress. Now on to decompressing the hip through a blocked pigeon lift stretch. So put something underneath your knee. I'm using a yoga block. You can use a bath towel or a beach towel to elevate one knee, then cross the other leg over the knee and simply lift and lower the back knee, adding more or less pressure onto the blocked knee, hence the glute. If you feel a good stretch in the hip, you can keep the knee down and hold that stretch, but I am more of a fan of an active stretch. Going up and down, I think helps to decompress the back of the hip actively. This is the third category, rotational exercises. This first one is difficult, but if you can do it, it is absolutely magical. In a second, I'll show you a much easier way to de-rotate your spine, but this exercise is so powerful if you can learn how to do it. Put your feet on the wall flat into a 99 bridge position. Elevate your hips just a little bit. Keep your lower ribs back on the ground, but your hips up. First, try to move one knee back and forth as you keep one leg stable, and then move the other knee forward and back as you keep the other leg stable. Then you want to try to move both legs together at the same time, one going forward, then one going back, and alternating, one going forward and one going back. This is the natural alternating motion of the hips we are trying to restore. If you need a little help, you can use a foam roller to help you roll and shift your hips back and forth. Your hips will love this. This is absolute magic. It will take time. Please be patient with this exercise. Go slow if you can do it. There's so many good things that will happen to your hips and your back, but let me show you an easier version. The final way is rotational and more of a side bending. Because sciatica is usually on one side, this will really help open that one side of your spine. Place your elbow on a couch or a bed. My couch is a little bit low. You might want to get a little bit higher here. Bring one leg up and then lift your hip up and down. As you lower the hip down towards the ground, allow your spine to bend, let your lower ribs come down, let your shoulder come up, and open up the lateral or outside, the bottom part closest to the ground. Allow that just to kind of relax. Going up and down will help to contract the muscles, but then help them to relax on the way down. If you feel a good stretch, allow your hip to sit down. If you want a better stretch, reach your hip out a little bit more or raise your elbow up higher a little bit more. Do it for about 10 to 15 reps, 5 if you're really hurting. But try to build up the repetitions and try to build up some consistency. If you're hurting a lot, you can do it 2 times a day. I would suggest at least 3 times a week. But if you feel ones are better, do them as much as you would like to. Try to think about them as taking medicine as well. You want to do them until you feel better, but then also continue to do them, especially the 90-90 hip shift, the second to the last exercise. If you can perfect that one, it has benefits that will outlive so many other injuries and prepare you for other ones. The spinal decompression will take you a long way. Those are also the first 2 exercises we did. The door frame one especially is a very convenient exercise that you can do daily. If you can find a door frame, you could do it at work and just slowly decompress your back. I would say if you stagger your feet, you might find that one side is a little bit better. That's probably the number one exercise to start with and get better at. But once you progress, make sure you hit the hips, make sure you get some side bending, make sure you can use rotation. This is not a comprehensive plan, but this should take care of 80% of the stuff you have going on with your sciatica. Hopefully I'll make some other ones, but this should cover a good deal of what you guys have going on. I really hope this helps. Please let me know in the comments below if it helps. Like and subscribe. Share this with someone who needs it. Hope you guys feel better. Thank you so much for watching. Peace.